KV Dhanya, BAMS, MD Ayurveda, Amrita Vishwa Vidyapeetham, Kollam. Professor in Pathology, teaching yoga last 8 years. Completed Master of Science in Yoga. Studying International Yoga Therapy course from Manushi Institute of Yoga, affiliated with IAYT USA.
KV Dhanya, Health Warriors of Yoga Therapy. We are proud of your yogic services.
Good evening, one and all. Today my topic is a rare disease which I got in my hospital itself. I studied only. Now only I got this such like case in my hospital. So I am taking this topic in this particular point of view. That is nothing but syringomyelia. How it can be managed with holistic approach. A case report. So first slide, sir. A rationale. Nowadays, so many diseases are coming new. Like that, when I was sitting in OPD, I got a case of low back pain that with interest, I am telling it is not only a man that who completed MBBS degree, that is the main impact on this case that I should take to present before you. He also know the only diagnosis already diagnosed through the MRI reports, that is he is having a rare neurogenic disease, nothing but the syringomyelia. That is, if we see the prevalence rate, 3.3 to 8.5% only the person will get. That also an young adult to up to 40 years of age. He is nothing but 28-year MBBS graduate. The United States, that is, these neurological disorders are very common, that most among the Africans and Americans. Then these are the scientific studies. While I searched in PubMed and other Google Scholar and all, these are the studies around done through the syringomyelia cases which I got from the literary review. Then, sir, next slide, sir. Aim or goal. My goal was to, whichever symptoms that and all be mimicking to the lumbar IVDP that related to sciatica.
Ma'am, you are muted, madam, please. Ma'am, you are muted. Dhanya, ma'am, you are muted. Dhanya, ma'am, you are muted, madam. Okay.
How you and then? Am I audible, ma'am?
Now you are audible.
Aim or goal in between is coming. Sorry, sir. To reduce the symptoms, how to implement our
Ma'am, again it is muted, madam, please.
a normal life of symptoms with syringomyelia, but with our yogic tools. Then a kind of rare disease, the age was young and a medico and cause is unknown. Spinal tumors and all it is telling, but it is cause is unknown. To analyze the effects along with Ayurvedic treatment, what we can given by yoga, we have to think. Evaluation procedure I done with that, only the MRI and CT and plain pain scale assessed, but CT was not taken, and in the textual reference, complete blood checkup was done. Then next slide, sir. Structuring the therapy, the patient has, first of all, the pain was the main symptom. That is from the lower back to the leg it was. even though the cervical spine was also affected, the syrinx, that is nothing but the fluid-filled space, can be seen in between the cervical up to all the vertebrae. When there was 2016, MRI was taken up to D2 level, the syrinx were there. Then the last taken was on the 2019, only up to cervical level, the syrinx reduced. How? The only by the pain management by them, that is MBBS doctors. After that, he was very stressed and he was come to our hospital. First of all, we have done the pain management. All the cranial nerve examinations was very good, that is normal. All the deep reflexes and all were normal, but sensory loss was there. Touch and heat he cannot identify. Then first of all, what we did is the pain management. The first day itself, I done with the yoga, that is I started with deep breathing. In that itself, he was stressed back because he was not able to sit properly. Because of this disease, he was so much tensed and stressed. So within 2 days only, he can do the deep breathing itself. Then only I did the yoga nidra first I did, because I want to relax the patient. In between our internal medications and pain physio was going to reduce the pain. Within 4 days of yoga nidra itself, it was a very good result in that patient. He was able to sleep properly. Then this were continued up to until the treatment was over. That is nearly 28 days the patient was with us. We did all the Ayurvedic medication along with physio, and after the pain reduction, we did slight grade 1 physio, that is exercise, and in course of time, I started daily 3 round Surya Namaskara and some forward bending and Artha Chakrasana. Why? Because doing the Artha Chakrasana, the pressure, the gravitational pull towards the gravity, that is downwards, the syrinx, the fluid-filled spaces will be getting the pressurized and the fluid may go to the other spaces, and forward bending also, the sudden flow of blood will be there so that CSF circulation will be proper. The CSF is getting filled in the cervical vertebrae. That was his condition. Then all other purificatory procedures also we done, and selected pranayama only I have given after doing the Surya Namaskara and all. Why? Because all the Kapalabhati and all if we do means it is irritating this thing, that is pressurized will be more. So I did only all cooling pranayama and relaxing pranayama and has given Om chanting for only 25 times. Now he increased the Surya Namaskara up to 10 rounds. He is nothing but Unni Narayanan. Name is also there in the full paper. So I was very glad that the symptoms were reduced by the patient. Sir, next slide, sir. That is relaxation. For what we are giving the relaxation, that is energy level of the patient or the client was very less at that time. To activate that, we used to give that affirmations also, but the patient was very cooperating. Daily, if we go here, the stress level, we can, by the seeing the face itself, we can identify that. Like that, each and every one, we have to study each and every client. We studied yoga therapy, but we have to admit and we have to do the cases. Then only practically we can prove ourselves what we can do. Sir, next one, sir. Then the medicines were there. Medicines, we were advised him after all the things. That is Snehapana, that's like Sadish sir told, Snehapana, Virejana and Nasya, because the nose is the opening for all the brain and brain related. all the nerves are rejuvenated by nasya. All we done, even pranayama also, oxygen supply will be getting each and every cell, and the regeneration happen to the nerve cells. So it is very good. And diet is also advocated. All the Vadahara, we are considering it as Vada predominant disease. So diet also, not Vadavardhaka diet we advised. Some diets like newly harvested diet, newly harvested rice and all we advocated. Then sesame seeds and all we advocated. Then selected yogasanas according to his capacity only he should do. That I recommended. That is only 5 rounds. That he stretched up to now 10 rounds. Then the pranayama also only 6 rounds. Sir, next slide, sir. Conclusion, but the main lacunae, the symptoms and all were reduced. But one thing I didn't do is, after all the treatment, MRI was not again taken. That was the main lacuna. We have to prove how it reduced. We have to prove that I didn't do, but a very good symptomatic relief was there for the patient, for body and mind. Then only one case I got and evaluated. Then like this, yoga therapy can do many things in future also, I understood. This is my conclusion from one single case. Thank you, sir.